Okay, my Harris ER friends. Today we're going to shoot a short video talking about how to set up an art line, where to find your supplies, how to troubleshoot, and how to hook it up to the monitor in the room. And then we're going to have a second video that talks about how to hook it up to your transport monitor when you're transporting your patients. So the ArtLine supplies are located in the critical care carts. On the left side, you'll see drawers, but also it's to the right of rack 3 is Art CVP supplies, and you'll find everything there. You want to get a 500 ml pressure bag. Yes, can you use a 1 ml, but this is best practice and definitely better for keeping your pressure. A 500 ml bag of NS. On the rack, you're going to find the pack that says Trans Pack IV. How you can guarantee that this is for art lines is it has the blood sampling. So when you when you look inside the package, you'll see the purple blood sampling. The CVP doesn't have that. You'll know you'll have the right one. Also, if your IV pole doesn't already have it, you'll have the clamp and the transducer holder. The transducer holder has to go with this 0 line on the top. This is where you measure your phlebostatic access to make sure that you are getting a correct reading. So after you spike your bag and you open up your pack, the way you're going to place this is you're going to have the tail, the part that connects to your monitors, arrowed facing towards down. So I like to say tail down. Inside your pack, because this is equipment from education, this actually will be a white cap that you can actually prime through. It's open for sterilization, so a little bit of water will squeeze out. This is the closed cap that once you're done priming, you will replace it with this cap. Okay, so the first thing you want to do is you want to get the pressure. Pressure is critical for the art line because that's actually how it works. In order for you to get a reading, you have to have enough pressure flowing against the arterial blood flow, and that's how you get the reading on the monitor. Why is this not working? There we go. Okay, there's the yellow. And you want to go to green. So once you're at green, you're good. If you are having any trouble with your art line, the first thing to check is to make sure that you're at 300 millimeters per mercury of pressure. That's how much pressure that you need for order it to combat against the arterial flow to get a reading. The next thing that you're going to do is there's 2 areas to the priming. So you're going to be priming to the bag to atmosphere and then priming to the patient line. Patient line comes up off the top. So what you're going to do is you're going to actually open here, so let me get this off, to the atmosphere, we call it, and you'll see the water come through. So of course this line is primed already, but you'll do that until you have 0 bubbles. Replace that, and then you're going to turn it off to atmosphere. Now we're going to prime the patient end. Of course, being really careful because this is the sterile end that you're going to hand to the doc once he's placed the catheter. And then you're going to make sure that that has 0 air bubbles. Second tip of troubleshooting, if you are having problem, check your line, make sure that you have no bubbles because that definitely will impede getting a reading. Once you have that primed and ready to go, we're going to set it up to our monitor. So you're going to see the monitor isn't showing any art line measurements at that point. It won't until you plug in the cord. It's going to be the red line with the telephone jack on it. So we'll plug that in there. And then you're going to see P1 comes up. This part here attaches again onto that little tail. So you just attach the 2 pieces. Go. And then you'll see we're starting to get a little something there. We're going to touch there and you're going to label it. So you hit P1, you see there's different lines you can label. We're going to hit art line and then we're going to 0 our line. So how we're going to do that is we're going to open up to atmosphere. We're going to push a little juice through there and hit 0. Okay, and then once it's red, we're gonna attach our cap back on and close it off to atmosphere. One of the ways you can tell that you're getting a reading is just a trick tip is if we close this, once you're set there, if you wiggle your line, of course we can see it here, you can tell that it's getting a little bit of a reading. That's how we set up on the in-room monitors in an ArtLine. Well, one last thing I do want to mention is phlebostatic access, right? So that's very important. We will not get an accurate pressure if you don't have that. You have your zero line, so just as a reminder, phlebostatic access helps us to see where the heart is. It's going to be fourth intercostal axillary. So if your patient's lying down or if they're sitting up, that's where you want to measure this line to. Some people for transport will even just tape it to that site so that you're getting a proper reading, but just remembering to continuing to like eyeball where that phlebostatic access is so that you're getting an appropriate reading.